All right, remember that stat. 1 in 3 women will die from heart disease. Let's unpack the symptoms and the solutions. So Cone Health cardiologist and clinical integration officer for Cone Health Center for Health Equity, Dr. Cardi Taub, is joining us. You just saw her in the story. Let's talk about how common heart disease is in women.
Anya, thank you for having me here, and I enjoy talking to you always. Heart disease is very common in women. The common myth is that breast cancer is more in women, but it's heart disease. 1 in 3 women will die from heart disease or have some type of complications, so it is very important.
I think people think, okay, I'll pay attention to my heart health later on in life, but they may be missing the fact that they need to make their heart health a priority earlier on in life. So what age should we be looking at our heart health?
Starting a healthy lifestyle has to start from childhood, really. It should be a family affair. But when you start talking about adult women, think about when people are talking about their 21st birthday and how they're going to have a good party and get alcohol. They should really start thinking about how they can really get a primary care provider. They can be able to get blood tests, note their blood pressure, eating right, and looking at those numbers like their cholesterol and things that would keep them healthy.
Okay, so it's not at the age of 55, 60, 70. It is at 21. You need to start paying attention to what's going on with your body. All right, so Cone Health offering a free community event for women all about their heart health. Let's talk about that.
Yes, let's talk about it. So we're excited. This is our 4th annual Women's Heart Community event. We've been having this over the last years. Our theme is saving the hearts of women through education. So what that means is we're going to make sure that women in our community gets awareness of heart disease, how they can prevent it, how they can, if they're living with heart disease, what they can do to live a healthier life. Because remember, everything we do, if we start to practice what we do and get healthier, we're able to prevent heart disease. 80% of what we're telling you now of heart disease is prevented by knowing your number, knowing that this is you can be affected by it. So that's important. Please come out on February 7th.
All right, that's February 7th, 8th until 1. Is it just show up or do they need to kind of register ahead of time?
So it is, we will encourage people to register so we kind of know who's coming. But please, if you can register, it's not a requirement. It's something that we're asking, but show up. There are lots of activities. So we're going to have a keynote speaker talking about cardiovascular disease in women. But most importantly, I want people to know that we're going to be screening. We're going to be doing blood pressure screening. We're going to be doing blood work for blood sugar and the cholesterol. We're going to have our mammogram vein there. We're going to do something called ABIs, where we're looking at the blood flow in the extremities, meaning the legs and the arms. So you don't have to really attend the whole event to be able to take time off and say run on your lunch break or write some break and come in and get screening done. So we're really asking women in our community, and if a male partner come with them, that's fine. They can get screening. It's important that everybody gets screened for cardiovascular disease risk factors, so that way we know how to take care of you and how to keep you healthier.
All right, mark that on the calendar, February 7th. I mean, so often we don't take enough time to do all those tests. So if it's all in one spot, that makes it super convenient. Okay, let's talk about some unique things that are unique to women that could increase the risk of heart disease that they need to be aware of.
So we do have traditional risk factors that affect everyone, including males. So high blood pressure, diabetes, high cholesterol, if you smoke, people who are inactive, and obesity, meaning that their body size is really bigger with their height. But when it comes to women, there are things that we want women to be aware of that is not usually talked about. So those emerging non-traditional risk factors. So women who had high blood pressure in pregnancy, we want them to understand they have high risk for heart disease as well. Diabetes in pregnancy, women who have polycystic ovarian syndrome, meaning PCOS, it increases their risk. Women who are going through menopause, menopause can increase because you're declining in that estrogen protection, the bad cholesterol is going up, the good cholesterol is going down, and also women who smoke. And these other women who actually have rheumatoid arthritis, even though that impacts males, but with females in those diseases comes the higher risk for heart disease.
Right, so if you heard any of those other unique things that could make you more susceptible to heart disease, you definitely need to be talking to your doctor about what you can do because of that.
It is very important. Talking to your doctor, I tell everyone, have a primary care physician provider, someone that you can actually relate to, someone you can talk to, tell them everything. They wouldn't judge you. You need to talk to your doctors, ask the questions. You also need to know when your blood pressure is taken, ask the person, what's that number? It is your number. You need to know it. When you get your blood work done, go through that number. And now it's so great where you can see the green and the red, just like the traffic light. Red is bad. So when you have red, ask the questions, what can I do to bring this down? One of the things that I want people to be aware of when it comes for screening of a heart disease, males or females, there are different things that we're looking at now, something called coronary calcium scoring, which you don't have to have symptoms of heart disease, but if you have those risk factors that I talked about and you have a family history, very important. Family history is defined as your mother having a heart attack less than the age of 65 and your father less than the age of 55. You want to be asking your provider about a coronary calcium score. Another blood work that is not cholesterol, but it helps us understand if heart disease is going to be a factor for you, something called lipoprotein A. It is inherited. So if you have it, your risk factors for heart disease is going to go up, even for stroke and sometimes valve disease. That blood work, you only get it once in your lifetime. So it's important that people talk to their providers about this, and if they don't have the understanding, that we are here to educate people. And that's why you really want to come out, because if you get that information on Friday, February 7th, you can share it with your family members, neighbors, and friends, and people who you network with.
Okay, and when we come back, we're going to talk about signs and symptoms of heart disease different in women than in men. Right now, we're going to take a quick break and check out and see if it's still snowing here in the Triad.